not all mucus is created equal. Not all mucus is bad mucus. So when I'm looking at a diaper, the first thing I want to know is how old is the baby, and what are they consuming, and are there any other symptoms? So the reason why I ask about how old the baby is because around age, like around that 2-month time frame, 2 to 3 months, is when the baby's salivary glands start producing all that like wonderful drool that's everywhere. Some babies are a little sooner, some babies are a little later, but they start producing all of that drool and saliva, and not only does that get all over everything, but also comes out the back end of them. So that's the first thing, is like, how old is baby if they're like only a couple of days old versus like, yeah, they're 2 months old and they're drooling their little faces off. So that's one thing. The second thing is the consistency of the mucus. So when the stool looks homogeneous all the way through, meaning that it looks the same, it is a diaper that's just stool and it's shiny. It's a little shiny all the way throughout, or you do this number, I've done it, I know you've done it, and it's kind of stringy all the way throughout. That's what I would consider like the same all the way through. It's uniform all the way through. And when we see that, it's most often from up here. So it could either be that like baby's a little congested, they may have an illness, they may be drooling their little faces off. And so it goes all the way through the system, and we see diapers that are a little bit shiny, and have maybe that like stickiness, stringiness situation going on. If the diaper otherwise is a great color, there are no other symptoms that baby's experiencing, there's no blood, I don't consider that a fail diaper. That is a regular diaper, and we have research on this. There are scientists that did this research on this for breastfed babies in 2018, where they took over 1,000 samples, little baggies attached to little baby butts, and collected these diaper samples and saw that a certain amount of mucus was absolutely normal in healthy breastfed babies. And so you almost get like a soup looking, or almost where it looks marbled, where it's all the way through the diaper. When I get concerned is when the baby's mucus, the mucus in the stool is either more mucus than there is stool. So like, what's the ratio of mucus to stool? If there is more mucus there than there is stool, it's like just a glob of mucus that's a coloration of stool, if even that, that's a red flag. And then 2, is there a concentrated form of mucus, meaning like a glob or a blob mucus in the diaper? We have picture examples of that. We collected lots and lots of diaper examples. We give full galleries, freetofeed.com/diaper if you want to go through some galleries. So green and mucus, yes, that can be a red flag for food reactivity. There are a few other things that can cause green and mucousy stool as well. So most certainly go check out the Diaper Decipher article to dive in and see like, what does your diaper really look like in comparison to the galleries and the research that we have there. So that's really important to know. And also, the reason why it's really, really important to know that not all mucus is bad mucus is because oftentimes in our community, parents will be like chasing this perfect diaper, right? And we all know what I'm talking about, the like peanut butter spreadable, yellow, popcorn smelling, seedy, like the heavens are shining down and the angels are singing at this beautiful diaper that we're chasing. And for some of us, that's not what we're going to get. And maybe we had that for a little while, and then the salivary glands start producing like crazy, and now we don't have that anymore. So just to know that like, it's so incredibly painful to find families who have just cut more things from their diet when they didn't have reactivity stools in the first place.